and that happened to me. So I was told over the intercom that there was an ambulance bringing a 6-month-old to our emergency room that who was having a seizure. So kind of everyday stuff, nothing major, and they bring in this little girl and her parents. I can't remember the parents actually, I remember the girl. And she was having a seizure. Her left hand was twitching, her eyes were deviated and kind of jerking around. And she was kind of awake, but yet not awake. We treated her with some lorazepam, and the seizure stopped. And I didn't really think a whole lot of it, except that it was obviously a partial seizure, which always makes you a little more worried that this is the start of something more. So right there and then, I was there, I watched the event. I was completely convinced that it was a seizure. I saw it, it was there. So we did workup, we did a good workup, I think. And we started her on anti-seizure medication. And initially we thought maybe things were going okay. Then she started having some more spells, and these parents are devious because they didn't let me know about all the spells, and they didn't always come to the emergency department because we didn't really do anything. We always did the same thing that they could kind of manage at home. So I didn't hear of all of her spells, but it became obvious pretty quickly that the medication that I was using wasn't quite working. But they started telling me other things that I chose to ignore, like that if she went to sleep, that she kind of woke up okay, and then she wasn't okay. And I was still really fixated on my diagnosis of it being epilepsy. So I really just kept trying. The zebra came in, it had all kinds of stripes, and I just kept trying to wipe them off. And then, just all of a sudden, I just heard this little voice that was like, hey, do you need to take a step back and think about what's going on? This is not quite fitting into what you had been trained, and this isn't how it's supposed to be. So I think that I was fairly open with the parents, and I hope they don't come up and say that, no, I wasn't. Because I kept saying, like, this is a little strange, and they kept sending me videos, and I remember distinctly they took a vacation and went abroad, and they're in this, I don't know, it looked on the video to be like an Airbnb or something, and she starts having a spell, nothing much, just a seizure, and then she was always a little limp on one side after her seizures, and sometimes it was the right and sometimes the left, and that even didn't, like, make my brain start to think correctly. So they brought this video of this little girl in this Airbnb, and they just sat there with her, and she was completely quadriplegic. She had no movement whatsoever, and these parents, being the devoted people they are, were trying to feed this quadriplegic little girl, and they're showing me this video after this is all over, and they're back in Iceland. And I just remember I was this close to just falling on the floor. Like, watching this video just kind of shook me to my core. Like, how can these people be doing this by themselves? And I keep thinking it's epilepsy. So I think that was when I told them that could this be something else? I've heard about something called alternating hemiplegia, and I'd actually seen one patient while I was training at CHOP in the US. And I just remember when I heard about it and sort of what happened to these kids. And there was another resident or another fellow with me who took this patient on. And I remember I was a little happy that it wasn't my patient, because it seemed like whatever, despite his best intentions, that this was really going to be very difficult. So at the very end, I came to my senses, and sort of that's how the story of Suna and I start. And that's a picture of us when I was at work. I moved back from the States in January of this year, and I was working, and she came to see me. I hadn't seen her in a few years. And then all of a sudden I realized I had no ride home. And I was like, oh, I need to get home. But, I have a husband who often, isn't quite where he's supposed to be at the right time. So he was late to coming to pick me up, and what do? They drove me home. So this is kind of what has happened with a relationship that I wasn't asking for when I was in the ER. They certainly weren't asking for when they had their little infant at home. But somehow I stepped into their living room, and I've kind of been there ever since. So in my mind, I formulated, what am I looking at? I just really need to pull it to pieces. okay, she was having episodes. Okay, that fits with epilepsy. She was having uncontrolled movements because I saw them myself. They tried to tell me that there wasn't a whole lot of that. I just chose to ignore them. And it stopped with meds. We gave lorazepam. She fell asleep. It got better for a while. Then we started the seizure medications. Did it prevent the spells? No, it didn't. Right there. You know, that should have told me something. She had alternating hemiplegia. While people with focal epilepsy will often have an underlying structural abnormality, so they'll always have their hemiplegia on one side because the seizure is always coming from the same area. So that should have told me something. The aborted with sleep, you know, I didn't even know what to make of that. While I wasn't paying attention, I couldn't understand why they kept bringing that up. So, and then finally, I remember, because we're in Iceland, where nothing comes easy, we were trying to do an EEG in a spell, and I don't know what, yeah, they're over there. So I don't know how many spells it took before I could literally wrangle the EEG technician to come in on an off hour, and she complained and moaned about it. We got it, and she was in the midst of a spell, and I could not believe what I was seeing on my EEG. It wasn't a seizure. So I sent an email. So I saw her in August of 2016, in the end of August, and in April I sent an email. And if it's okay with you guys, I'm going to read it to you. I sent it to Jim Riviello, who's a kind of a famous pediatric neurologist who I knew from Boston Children's because we transported all of our difficult epilepsy to Harvard at that time. And I have a 14-month-old girl, Sunna, who presented at the age of 7 months to the ER in what looked all the world to me like a partial status epilepticus. I was on call, watched her being wheeled in the ER prior to any meds. Eyes up and to the left arm and leg shaking, and a dramatic response to a couple of doses of Ativan. I don't know whether it was a dramatic response. I wanted to make it sound like it was a dramatic response. So it turned out that there had been some prior episodes, 2 I think, and you can kind of read how I'm trying to minimize that the parents had summoned a doctor to their home, but somehow everything had subsided before nothing was ever done. And she was a previously healthy girl, but had been worked up at birth with a little bit of nystagmus that in the end was felt to be congenital nystagmus, and everyone felt that it was getting a little bit better. Again, probably something that we were just deciding was getting better, because it fit what we had decided this was. So her development had been normal. So when you guys are talking about the importance of doing something quickly, read that again. Her development was normal. I really, truly think that if we could stop the spells or do something early on, you know, and I'm certainly hoping that is in your guys' future. And then I told him everything that I had done, trying to make him feel that I was really good, how many MRIs or what we had done. And then I said, what always has troubled me is that Sunna becomes hemiplegic after every event, lasting a couple of days. This happens on the right, and then maybe with the next event on the left. To make a long story short, I'm strongly suspecting that she has alternating hemiplegia. Can you hear how I'm trying to convince myself that I've finally gotten the right diagnosis? Which leads me to think that my initial observation in the ER was not correct. My question to you is what you think of that. Because I needed help. I'm here alone. No one has ever seen it except me. I've seen one patient. I needed someone to listen to my story and tell me that I was on the right track. And then I said that I was going to start flunarizine. Better late than never. So I did realize that maybe I should have come to my senses quicker, but at least I was going to do the right thing when I finally realized it. So, and then I wanted him to know that this really wasn't this simple. So I started to say, this sounds more clear-cut than it has been. It probably was really clear-cut, I just didn't want to realize it. If you have any suggestions, I'm all ears. And that was a pun because my name is Ear. So, and then I asked him whether he was coming because they came once a year to Iceland. So I was asking him whether he was going to come. So he answered, and this is what collegiality is. This man, this really difficult man, and a really busy man, answers me in this way. Please always feel free to ask. And I remember that I was like, okay, I can work in Iceland, because I really had started being like, whoa, what am I going to do? I can't even figure out the most simplest of little kids. But then you realize that you do have backup, and it's only an email away, and you have to find those people that are willing to take time out of their day to help you out. So, okay, so I had thought she had intractable epilepsy wrong, you know, and so I started looking, and I found some other people who had made the same mistake, which made me feel better. So there were a couple. If you go on PubMed and you look up alternating hemiplegia looking like intractable epilepsy, you will at least find these 2 articles, which made me feel a little bit better. So I think that what in the end I had to think about is, could her presentation be a little bit unusual, but for the common disease of epilepsy? Could she have 2 diseases? Was that nystagmus truly just congenital nystagmus and didn't have any weight on what was going on? Or could this be a rare disease? And if so, what was I going to do about it? And they are hard. They are very hard. They are more in number. Rare diseases are more in number than common diseases. But the likelihood of me finding one, and if I am presented with one, as clear as Sunna was that day, it's more likely that I will try to pin it on a common disease. So 25 million people in the US have something that's been, that is a rare disease, and it's often extremely hard for them to get an accurate diagnosis, and have often been diagnosed multiple times. So is it because they're so complex? It isn't because they're so complex. Sunna wasn't that complex. I just didn't listen to all of the information that was kind of either being told to me or was obvious in front of me. So I finally had to almost tell myself that I am not going to be able to figure my patients out if I have my hand and my ego, because a doctor really does not want to decide that they've done something wrong if I have that in front of my face. So I think that that was a big wake-up call for me, and something that has made my life really easier since then. So what makes it hard? What makes it hard to figure this out? Well, some of the things are to do with a disease. So a disease can mimic something like Sunna almost mimicked epilepsy for me when she walked in, where she was having a seizure. So she mimicked having epilepsy. And then epilepsy can almost be thought of as, can be a chameleon. So it doesn't look like a seizure, it looks like a psychiatric disorder. So you can go both ways. You can have false positives, where you think it's epilepsy and it's not. And then the other is false negatives, where you think it's not and it is. So the patient and parent specific factor, I think that the parents in this room could tell me that more, but I'm going to tell you what it looks like to me. When I have seen patients, and maybe more in the States than I've seen here, where they have been through this diagnostic dilemma, they have been to multiple providers and no one has been able to tell them what's going on, what they start doing is they start trying to find these little tiny bits of information that they think might help the next one. So they add to their storytelling, and all of a sudden that kind of becomes a big thing, when in fact the simplest of items were really enough to tell me the story. So you get almost too much information for you to be able to kind of garner through it and figure out what it is. So physician-specific factors, guilty over here, it can't be this, or it must be this. And then the ever-popular confirmation bias, when a physician has decided it's something and then tailors his diagnostic workup to trying to prove it. So he's not looking for everything and it's going to be narrowed down. He's decided what it is and he's going to prove it that it is by doing a certain amount of testing and just skipping all the rest. And then the diagnostic testing can be limiting too. So you can have, even now that we have this great genetic testing that's answering all kinds of questions. Just a side note, I left Iceland for 7 years, from 2012 until I just got back in January. And over that time, all my patients were diagnosed that I couldn't diagnose. So now, when I'm sitting in my office, I'm seeing my old patients, they all say, well, after you left, we figured out what it was. But it really isn't my fault, though. I tried telling them that, but they just yeah, right. So, and what I had at this time was there wasn't even a test for what I thought it was. And as much as that annoyed me at the time, I'm almost to the point where the genetic diagnosis is starting to, I don't know, I want clinical medicine. I love the fact of going in, seeing a patient, trying to figure it out, trying to look at the symptoms and then try to find a treatment that worked. Now almost we're getting it too easy. We're sending off these whole genome sequencing and we're getting these results back that you're like, oh. And the parent knows more than you on the first visit. They know more. They're like, yeah. So we were thinking we wanted to try this medication. I'm like, oh, all right. Let me look at that. And now I'm just totally honest. I'm like, let me look that up. At least I know where to look. So maybe I am of some help. But I do believe that, right now, I have 2 very difficult undiagnosed patients, and I still see the same kind of terror in the eyes of these parents. One is a 12-year-old boy who still does not have a diagnosis for his horrible intractable epilepsy. Not a diagnosis, he has some genetic abnormality, but nothing that we really feel fits. And I can just see that you never get one step past what's wrong with my child if you never get a diagnosis. So I do think that even if the diagnosis is difficult, at least you know where you stand and you can do the best for the children. So finally, it took me leaving in 2012 for this to get sorted out with Sunna, but I did have a clinical diagnosis before. So then, when I was looking to do this talk, I found they have this whole section on rare disorders, and this I thought was team-based approach, this is great. I'm just gonna, make my team, and then I'm gonna find all these zebras and all these colors. I'm never gonna have a problem again. And then I started reading the article, and it was undoable. It was just undoable, to tell you the truth. It was about sending information all over the world to all these brilliant people all over. No one is gonna have access to that in real time. You are in your emergency room with that zebra that just came in, and you just have to diagnose the best you can, treat, and release them home, and then look into this team-based approach. So I felt that even though this article was really nice about how they were going to do this rare disease clinic, which is great, it's not going to be the option for the majority of us. So I have to say that from Sunna and her parents, I've learned so much more than the science of medicine. I've learned the science of being a good person. And when I left Orlando, I got this on my Facebook, which tells me, I'll read it to you. If God is the author, there's something to be said about whom he allows to hold the pen. Our story starts with our sweet Dr. Ear, that's me. When we were unable, Dr. Ear guided us medically, always pointing us in the right direction, lovingly penning the last 2 years of Kate's story. She was the first doctor we met when our world turned dark that day. And today, on an abnormally gorgeous day, we say happy moving day as she returns home to Iceland. We are heartbroken to see her go. She will always be the one who calmed our fears, held our hands, and gave us strength when we had nothing left. And she will always hold a place in our hearts. So this is why we do what we do, is to get a Facebook post like that after all the other ones. I am big about listening and singing, I have to admit, in my car on the way home. And sometimes just songs speak to me. And this is one where I really feel like I, with a rare undiagnosed patient, am speaking to the parents. So if you guys want to read it or listen to it, it's a great song. It's just about how sometimes you are really just at the end of your rope. You do not know where to go. And is there a secret that I don't know? Is there a test that I should be sending? And then really the only question that the patient or their parents have towards you is just for you to tell them how to be in this world, tell me how to breathe in and feel no hurt. And I think that this, and then sort of after, and the word is wreckage, but after this, I don't know what's wrong with my child, I am pulled away from what I expected parenthood would be. I am pulled into this, funnel of just something taking you by surprise. Every day, I still hear the voice of a physician that speaks to you kindly and really wants to help. Because I really think that even in the darkest of moments that we can get out okay. So to you guys who are much smarter than me, let's beat that drum, let's make some noise, and let's solve this thing. Thank you so much.